Hey out there, everyone, and thanks for tuning in. I'm Explore Big Sky Editor-in-Chief Joe O'Connor. This is the EBS Virtual Town Hall. First, I'd like to give a shout out to our sponsors. Without you guys, we wouldn't be able to have these town halls, and we really appreciate your support. Big Sky Chamber of Commerce, L&K Real Estate, and Shore to Summit Wealth Management. Thank you all again, and we appreciate it. It's our 15th session. I'm joined today by EBS Associate Editor Brandon Walker. Tonight's topic is Winter is Coming, a look at the upcoming ski season and updates on COVID-19. And we're going with a different format today. This session will be more of a discussion, and I'll be chatting with Big Sky Resort General Manager Troy Nedved and Gallatin County Health Department Health Officer Matt Kelley about where we are and where we can expect to be this winter. Before we get into it, Brandon has a special guest. Brandon, take it away.
Thank you, Joe. Missy Botha played 4 years of varsity volleyball at Linfield High School. She then continued her playing career, taking her talents to the court for Division III Tufts University. Today, she's in the midst of her 4th season as the head coach of the 11-0 undefeated Lone Peak High School varsity volleyball program. Missy, we're glad to have you here today.
Thanks for having me, Brandon.
Of course. Well, so you returned a majority of your athletes from last season. After a strong season a year ago, what has elevated the team to this undefeated, performance that they've put on this year?
I think, Brandon, when you have a chance to have a group of girls for 4 years, you have the opportunity to instill your coaching philosophy and team culture from the time they were freshmen. So they have full buy-in into the program. Our practices run seamlessly. Expectations have been set and met, and you don't have to deal with extraneous stuff. They come in ready to play, and there's very little skill correction that needs to be done, so we can concentrate on actually making plays. And we've got a great group of 7 seniors. So when you've got that from the time they were freshmen, now they're peaking.
Yeah, well, talk about peaking and making plays. What do you believe is this team's greatest strength?
I think they don't dwell on any mistakes that they make. They need to be able to be clear-headed, to be able to perform in the next point, and they just don't give up. So I would say their grit, their love for the game, and their willingness to do whatever it takes to win.
Well, you've done a lot of winning this year, and obviously there haven't been a whole lot of struggles, but at times when you have faced adversity, Shields pushed you to a 5th set. When you have faced that adversity, how has this team stemmed the tide?
Well, I wouldn't say there hasn't been struggles. There's definitely been challenges for this team. These girls haven't had a homecoming. They've had no dance, no senior night, no fans. And it's not easy to play in a gym that sounds more like a library. Mm-hmm. And they came into the season knowing that it would not be season, and they needed to create their own energy. Mm-hmm. So, and even when we lost Maddie Cohn, she was out for 4 to 5 games. We had Jessie Bow playing outside hitter. She's a defensive specialist. So these girls adapt, they take on new roles willingly, and they just keep pushing. And even with those changes, the core of the team remained intact. We could depend on the experience and the will of the seniors. So, there's, as far as no adversity, maybe, it's because we haven't lost, but there's definitely been this underlying challenges that we've, risen to.
Yeah. Well, thank you for correcting me. And obviously it has been a challenging year in a lot of ways. when we spoke at the beginning of the season, before you'd even played a single match, I remember you discussed and touched on the girls having to be their own cheerleaders and be their own support system this year. Recently watching your match against Gardner, I don't think I've ever seen the team that animated. You say that's just kind of been the culmination of the way that this year has gone, or is that just has that always been there? You just really hear it now with it being more quiet in the gymnasium.
Yeah, I've had to not be so loud in the huddle too, because you don't want the whole gym hearing what you're saying in the huddle. But yeah, beating Gardner, that was a highlight. That was a huge highlight. Nobody beats Lone Peak 5 years in a row. It wasn't just beating Gardner, it's how they did it. And like you said, their energy was off the charts, and they were just on fire. But we had prepared for that match. We knew exactly what their rotation was. We had a play for every single rotation, and we targeted the right player with our serves, and so it was pretty cool to see a plan go that well.
Yeah, I would say going well is an understatement. Well, touching on the Gardner match, I know that was a big accomplishment for you, but to this point, what has been your highlight of the season?
Oh yeah, I was definitely beating Gardner. They are traditionally year after year, they're well coached. Their girls are always very competitive. They have one player in particular that is a very big hitter, and we would have practices just around that one player and what to do with that player. And that was a highlight.
Yeah, definitely. Well, that preparation paid off.
Yeah.
And in other conversations we've had, we've always discussed the big two, Gardner and Manhattan Christian.
Right.
Having already taken down one of your greatest foes, how would you describe the energy and confidence of the team ahead of the postseason and your match with Manhattan Christian?
Okay, so our match was in our season was a little derailed. All the girls are currently in quarantine, including myself. I just had a conversation with John Hannes, who asked me if I wanted to play Manhattan Christian the day after we are released from quarantine. And so there's two sides to that. We won't have practiced for 2 weeks. We're probably going to be a half a step slow, but at the same time, it's all about the postseason right now. So do we want to see what they are like on the court? Of course we do. We want the competition. So after talking with the team, they were all for it. And it's, what can we lose? I mean, it's like it's the end of the season. It's the beginning of the regulars of the postseason. So we need the competition, and we need to see what they've got.
Yeah, definitely. Well,
hey, we're coming out of quarantine,
well,
even if we lose, it'll be like, well, we haven't practiced in 2 weeks.
That's a great point. Well, lastly, with the team playing as great as they can, and, being a senior-led squad, what are your playoff expectations this season?
Oh, we're going to be really competitive. The will of these girls alone is going to get them far into the postseason. We've got the experience of Ivy Hicks and Chloe Hammond, who are our captains. They set the tone. Ivy never has a bad day. Chloe is just super steady in the back row. Our outside hitters are Riley Germain and Hannah Dreisbach. They bring power, but more than that, they make really good decisions, and they've had a great season rounding on our front row. And then our middle hitters of Maddie Cohn, who brings the hammer, versus TJ, who is like all about finesse, and she can put a ball wherever she wants. And then we've got our dream team defensive back row of Ruth Blodgett, Jessie Bow, and Grace Redmond in the back row. But I have to mention Vera, who is our freshman, brought up from JV. And so she's our 5'11" blocker, blocking against strong side. So this mix of girls they're just going to pull together. They're going to be like they're shot out of a cannon as soon as they come out of quarantine. And I expect nothing but the best from them.
Well, Missy, I think I'm speaking for everyone in Big Sky when I say good luck the rest of the season and into the playoffs. And I would like to thank you for your time this evening.
Okay.
Joe, I'd like to send things back over to you to continue the discussion.
Thanks, Brandon.
Awesome. Thank you, Missy. And thanks, Brandon, for that. Missy, again, congratulations on a fantastic year so far, and best of luck going forward.
Thank you. I appreciate it.
Sure thing. On October 15th, Gallatin County recorded its 5th death related to COVID-19. As of last Friday, the county had 271 active cases, and as of today, 15 hospitalizations. Statewide, Montana is among the top 3 states for new cases per 100,000 people at nearly 600 per day, an average increase of 57% over the average of 2 weeks ago. There are currently 5 times as many cases as there were just 1 month ago. And there are 11 cases in Big Sky that were reported just last week. My guests tonight are both pillars of our community and are both deep in battle with a common enemy, COVID-19. Since last March, both Troy Nedved with Big Sky Resort and Matt Kelley with the County Health Department of Gallatin County have been bobbing and weaving in their own ways and seeking the best approaches to handling the coronavirus. Gentlemen, welcome back to the Big Sky virtual town hall.
Thanks, Joe.
Yeah, thanks, Joe. Thanks for having us.
Absolutely. Matt, let's start with you. It's been 7 months since we began feeling the true impact of COVID-19 in Gallatin County. And now we're seeing a 3rd spike, as is the rest of the state. What are you attributing this to?
You know, it's an interesting question. I was struck the other day when I was looking at some of the national numbers, and they were talking about the national surges. And when I looked at that, it really mirrored what we have been seeing in Gallatin County. And it made me think that because of the connections that we have to the rest of the world, whether that's through MSU and the university, or the really diverse economy we have, or the being a tourist destination, whether that's Big Sky or Yellowstone or the trout streams, whatever the case may be, I think that we're connected to the outside world maybe in a way that no other place in Montana is. And so we're feeling many of the same things. We had done a pretty good job prior to this most recent surge in keeping our numbers low. And I think that was attributable to a number of things. We have pretty good adherence to the mask usage. We really are working collaboratively to try and reduce the number of big events and those kinds of things. But when you look out over the landscape around us, whether it's in Billings or Great Falls or Kalispell, when you look at the Dakotas right now have the highest rate of COVID cases in the country, not the highest number, but the highest rate per population. Idaho's got a lot of cases. Utah's got some problems, and Wyoming is surging right now. I've kind of likened it to, the sandbags during a flood. And at some point in time, the water comes over the top. You just can't keep it out forever. And I think that's what's been going on.
Mm-hmm. Yeah. Well, it's concerning on a number of levels. I wanted to ask you, just looking at the trend since last March, it appears that we're seeing a spike approximately every 3 months. I mean, early to mid-April, mid-July, mid-October. Is there anything to this trend in your mind?
Again, I think the initial surge was related to the fact that we're very much part of the world here in Gallatin County. The second one in July happened almost exactly right after the 4th of July. I think we had gotten through a pretty significant surge initially, had come through, and maybe there was a sense of we're through this. People let down their guards a little bit, and then we had that spike in July. We were about that time, the face covering mandate came in. We were able to do some things. I think people took notice at those numbers and dialed back some of their activities, and we got it back down again. The concerning thing is right now, I don't know if we're going to be able to get it back down anytime soon. We're not where we want to be this time of year. We're hoping we're going to have lower numbers heading into the cold weather. The cold weather is here. We have higher numbers than ever, higher hospitalizations than ever, and we're seeing really concerning hospitalization numbers across the state.
Mm-hmm.
So I think it's a mix of those things, and I'm concerned with where it's headed this winter.
Okay. Troy, your first year as GM at Big Sky Resort, what trends have you and the Big Sky Resort team seen over the past 7 months, and what was summer like from an operations standpoint?
Yeah, trends. It's certainly a dynamic situation. One of the trends that we experienced this summer is that there clearly is some pent up demand for people to want to get outside and get out in the fresh air and have fun. Boy, biking was ever so popular. A lot of things surprised us. Golf, again, not just Big Sky, but throughout the country was extremely popular. And again, goes along with that idea of people just wanting to get outside and stretch their legs and do all the things that we're used to doing. But those are some trends that we experienced. Also some variations to just a different type of travel, a destination traveler, and changed a bit. Obviously, people's willingness to fly is a little different than it once was before March. So yeah, a lot of obvious stuff there, but a couple of surprises here and there too.
Sure. Well, you mentioned the golf thing. I had heard it was up substantially. Any numbers that you have there that you're able to share, or?
Yeah, boy, it depends on how you look at it, but it's substantial is a fair way to look at it. It was undoubtedly a record for us at the Big Sky Golf Course, and seemed to be consistent throughout. Just selling out throughout the summer.
Yeah, well, it just does go to the show. People, really needing to get outside this summer and having the opportunity to do it in a place like Big Sky is, it's an opportunity second to none, especially times like these. Troy, Big Sky Resort, you guys had made some significant operational adjustments for this coming winter in dealing with COVID. Tell us about some of those.
Yeah, it's certainly different than we're used to, but similar to our summer plan, it was all about getting open and stay open, and that again is the basis and our goal for this winter's plan. But how do you do that safely in such a dynamic situation? You guys just discussed how quickly it's changing with really no identifiable patterns. So fortunately for us, there's a lot of folks that are doing a lot of great work in the industry. The NSAA has created a pandemic playbook for us. And on top of that, both our state and local health officials have given us a lot of guidance throughout. It's a constant conversation back and forth with our operations and trying to find ways to get it right.
Going into a little bit more into specifics, what adjustments have you guys made specifically in terms of, whether it's distancing or face coverings or lift lines, that type of thing?
Yeah. You'll see a lot of patterns throughout the industry as to how people are planning for this winter. We're taking a bit of a hybrid approach to what we're doing. And the main reasoning behind it is Big Sky Resort is different than many of our other comp set. We have a lot of acreage to work with, and for all of you that ski here know that that means a lot of elbow room. So we've been developing a plan that is ultimately playing on our strengths and hopefully mitigating our weaknesses within that. Yes, the specifics. I mean, this is nothing unique to us. This is what we're all saying, which is if you're sick or been exposed, you need to stay home, just out of respect for everyone else. And then facial coverings. You heard Matt reference it just a little bit ago, and it's the anchor point to our plan. It's not the key piece, but it's a big one to our plan. Our communities embrace the use of masks, and so is the resort. I think it's essential to our winter operations. And then lastly, the social distancing piece. Again, it's not unique to us, but giving people proper space everywhere you can. Our normal operations of lift lines, of food, of bathrooms, all of these things, we just have to look at it differently. And we've really broken down every activity at the resort, identified places in which we can realistically make changes and keep people safer, minimizing exposure. So again, facial coverings is absolute key to our program.
And is that sort of everywhere at all times? Is that, all guests, all employees? Is that, yeah.
That they're so it's all guests, all employees. It is everywhere where you cannot safely social distance and easily safely social distance. So it's encouraged to have facial coverings on all the time, but it is mandatory and essential in our lift lines, loading a lift, riding the lift, getting off the lift, in our food and beverage establishments indoors. Obviously, if you're seating and eating, as everyone understands, that is a little different piece, but it's essential and it's required. And we're going to do our best to communicate that. Obviously, it's becoming a norm throughout that everyone gets that in most travels, that's an expectation, but we want to make sure that no one is surprised. It's a collaborative effort, and we all need to own that responsibility.
Sure thing. Well, Troy, I know you and the team with Boyne and Big Sky Resort worked so hard to figure out what that plan is and been working on it for a long time. How did you go about forming that plan? I mean, I'm sure you were talking to other resorts, other mountains, and in touch with them. I was just curious, sort of, if you could go into just a little about what it looked like to put that comprehensive plan together.
Yeah, it was really nice to see that everyone in the industry got together. It wasn't a competition, but it was, hey, let's get together. Let's figure out plans that make sense. We're all in this together. They learned a lot from ski areas in South America and the Southern hemispheres this last summer, and figured out a lot of things that do and do not work, and created kind of best practices that they've been suggesting throughout. And again, for us, we're a bit different in Montana. We're a bit different in Big Sky in the space and elbow room that we have to work with. So we created a plan with all of the resources available to us that seemed to make sense specific to us at Big Sky, specific to our community, that made sense for this winter.
Mm-hmm. Gotcha. Matt, let me switch over to you. From a health perspective, what are your thoughts? I mean, you mentioned, the sheer size of Big Sky Resort puts it in a different realm from a lot of other places, but just curious, your perspective.
After 8 months in this thing, we're pretty now getting used to pretty major challenges. And I think operating a ski resort in a pandemic qualifies as a major challenge, but we've sort of had a rapid fire progression of those challenges, whether it was the initial stay-at-home order or helping businesses reopen from that stay-at-home order. Shortly after that, we had Yellowstone Park reopening after it had closed. That was really significant for West Yellowstone especially. And then we And then we had kids going back to K-12 schools. We had MSU students coming back. That was a big deal. We're looking forward, we love having the students here. Once we get to Thanksgiving, a lot of those students will go home, and they'll stay home until early January. And then boom, it's, ski season, snow willing. And so it's really another challenge that we'll move into. It's gonna, like all those other things I talked about, business as usual isn't gonna cut it. It's gonna have to be different. And I think one advantage that we might have during ski season is people have hopefully gotten used to changing their habits and doing things in a different way, whether that's wearing face coverings or knowing if you choose to go into a restaurant or a bar, that you have to sit down. And in the state of Montana and Gallatin County, you have to wear a face covering. You have to get to your table, you sit down, and if you're there and you're eating and drinking, you can take it off and you put it back on. You keep that distance. And the other thing, I think that we have to take advantage of our advantages. And being in Montana, having that space that you're talking about, having a place the size of Big Sky gives you some advantages. If the weather is decent and you can stand to be outside, that's a massive advantage, because we know transmission really, the risk of transmission really drops as soon as you go outside and get in the open air. Of course, when you're skiing and it's bitter cold, people are going to want to be inside. And that's going to be a huge challenge for all ski resorts. I think we're going to address this the way we've addressed all those challenges. That's one step at a time. You're not saying no to anything outright, but also being cognizant that we need to work together and adjust. And I'm really hopeful that we can continue to work together, because, I think that's where we've really fallen down as a country, and maybe even as a state sometimes, is when we stop working together and we start pointing fingers at each other. So that's going to be my focus. I'm not saying it's going to be easy. I'm not saying it's not going to take adaptation, and it's going to take some sacrifice all around. But we're committed to meeting those challenges and trying to make them work.
Yeah. No, thanks for that. I think, the teamwork component of things seems, important on a number of different levels. Matt, quickly, what's your biggest worry that you have kind of going into fall right now and leading into winter?
I think you can I have worries in a number of different realms. Short term, I'm looking at Halloween, and I'm looking at what I know tends to happen, especially in younger age categories, where we're seeing really significant disease transmission on Halloween, and those parties that happen. I get asked a lot about trick or treat, and I want people to be careful trick or treating. I think the parties are the place where we have the most risk, and so to the extent that we can convince people not to do that, we can convince people that to maybe this is not the year to have the big Halloween bash. This is not the year to have people filing through haunted houses and closed settings. We take a step back from that this year in order to be able to do other things down the road. Medium term, I'm pretty worried about where our case numbers are right now, and I'm pretty worried about where our hospitalizations are right now, especially in relation to what we're seeing happening in Billings and Great Falls. We're at the cusp of cold and flu season, and that's going to make everything much more difficult to figure out who has COVID and who doesn't. It's probably going to get more cases because more people are going to be getting tested, just because they're going to have the crud. And so we're gonna need to work through that. That's a pretty big worry, making sure our testing system is capable of sustaining us through that period of time. And then looking out longer term, I'm hopeful that a big challenge that we're going to have in the 5 or 6 months ahead is that we'll have a vaccine to begin to distribute. And so we're already thinking about ways that we can get that vaccine. When it first comes, it'll probably be fairly limited to people in critical roles, or who have really underlying health conditions, older folks, long-term care facilities. And so that's my I want to call it a longer term concern, is that as we move into the spring and summer, that we have systems in place where we can really, as soon as we get doses of vaccine, we can get it out there. We can get into people who want to take it.
Well, just to elaborate just quickly on that, Matt, the state health department, the state health department from Montana announced this afternoon that it's submitted its vaccine plan to the CDC. What insight can you give us on that plan, and when might we see that vaccine in Montana?
Well, I just know what I read. I don't have any inside information into what the vaccine manufacturers are doing.
Mm-hmm.
In reading what's out there and hearing what's out there, I think there's a reasonable hope early in 2021 we'll have the first doses of the vaccine, probably in what they call an emergency use authorization. So using it probably directed toward nursing homes, long-term care facilities, those places where we tend to have the most mortality. And then as we move through the spring, hopefully it will expand. One thing to know about local health departments, ever since the smallpox scare, the sort of some of the bio terrorism scares back in the late 90s and early 2000s, local health departments have been practicing what's called points of distribution. The point of distribution is we can go and we have places set up all over the county where we can set down basically a system and move people through that point of distribution, whether that's a shot or whether we're trying to get somebody antibiotics. We've been practicing that for a long period of time. The other thing to know is we won't give most of the shots. Most of the shots are going to go out to healthcare providers. We'll push them out, and they'll be for those of you who lived through H1N1, probably something fairly similar to that, where local health departments and state health departments will be given sort of a prioritization. Maybe at the beginning it'll be people over the age of 70. Maybe at the very beginning it'll be pushed into nursing homes for staff and people who live there, and then expanding out of that, depending on what people's risk factors are. I can tell you that we're looking forward to it. We're looking forward to going on the offensive on this with this virus. Yeah. And I'm hoping it'll be a change, but I would be cautious. I mean, I don't think that the moment that the vaccine is approved, our problems are over. We probably have a good year or 2 or 3 to get through that process, but it will, I think, be a psychological help, and it will help us protect and cocoon some of those places that are the most vulnerable, which will take some pressure off of everybody else. I hope. Nothing is certain right now, but the data that's out there seems to indicate that we'll have at least one and maybe multiple vaccines, which will make it more complicated as we move into 2021.
Sure. Well, that's, it is nice to have some sense of a light at the end of the tunnel,
Yeah, that light at the end of the tunnel. I think we've been going for so long, not really being able to visualize when this could end. And I think, we have to be careful. This isn't going to end instantaneously, but just, I think, being able to have some idea that there's something at the end of this, it's helpful to me anyway. I hope it's helpful to others as well.
Oh, I think so. Absolutely. I mean, it's one thing that we can all hope for. Well, gentlemen, if 2020 was anything, it's been challenging to say the absolute least. I'd like to ask you both this question. What has been the most complicated, the most difficult component of your job in 2020? Troy, let's start with you.
Obviously there's so much uncertainty out there, and there's so many different opinions. That's obviously, that's not just around here, but it's throughout our country. I think the more challenging for us has been really managing our labor force in this situation. We're being asked to do things that go against our instincts of being social, of gathering, of all the things that many people do. It's whether it's youth or not, and trying to curb that behavior through all kinds of different age groups for a common outcome. This summer, again, it was about getting open and staying open, and the working with Matt's teams on contact tracing and trying to do the right thing with all that was extremely complex. Sometimes it felt like you're doing all the right things, and sometimes it felt like you're doing all the wrong things, but it's an absolute learning process. So I would say managing a labor force with many guests have been pretty fair through this. The expectations have been reasonable, and they get the challenges. But our teammates that are already putting themselves out there, a long way from home in a resort town, and it's getting our arms around there and them and making sure they're taken care of.
Gotcha. Yeah. Oh, well, thanks for that. Matt, biggest challenge in this very, very special 2020.
Well, it's not that, it's the damn virus itself. I mean, the virus is just insidious. It spreads before people, it can spread before people have symptoms. It affects people very differentially. A lot of people will have pretty mild symptoms and feel like they had nothing but a cold. Other people will end up in the ICU. And it's not just about age, it's about a number of different things. And then we're learning every day the different types of long-term effects that we're seeing, whether that's, heart damage, cardiac damage that we're seeing in some younger people, younger athletes that may heal itself, may not. Whether we're talking about some of the sort of arterial problems with blood clotting and strokes that we're seeing out there, to just sort of long-term chronic, what they call brain fog that's out there, to weird stuff like, COVID toe and losing your taste and smell. I mean, this is a bizarre virus, and we're just learning about it. And that it makes it very difficult to communicate on it. It makes it people uncertain. It makes people impatient. We're used to, in health, with cancer, with the common cold, with influenza, they've been with us for so long. We take for granted that we kind of know a lot about these diseases. This is a disease we're just getting to know, and that's really, really been challenging.
It's unreal, some of the stuff that's out there, and the different symptoms that people are getting, and it's all crazy. But gosh, you guys, both of you, just doing a bang up job. It's not easy. No one knows what to do, but it seems like you guys are really handling it as best as anybody can. We're really all in this together. How can we, Big Sky Resort, locals, guests, into Gallatin County, even Montana, how do we, Troy, you mentioned get open and stay open. How do we do that safely? What is the role that we all need to play here?
Is that for me or Troy? I don't know.
I'll go for Troy. We could ask Troy that first.
Okay, good.
Sure. I mentioned it earlier, is looking beyond ourselves. It's not about each of us individually, the potential of getting sick. It's the concern of spreading and getting others sick. It's a collaborative effort throughout to do things that we typically would not do to get us all through this safely. We're social creatures, and we want to ski. We want to get out and get outside, riding a lift, loading a lift, close proximity, all those types of things that we're going to have to all resist some of those temptations and give each other a little space, calm down, and look at the bigger picture to get us through.
Yeah, absolutely. Matt, same question, how are we kind of in this together, and what can we all do?
Well, I think what Troy said about human beings, every impulse in us, for most of us, pulls us together. We have a need to be together. We're social people. And that when you're in this situation, that's sort of anathema to what you do to limit disease spread. And so even though we have to be physically apart, it's going to help us defeat the virus. I think it's really important and critical that we find ways to deal with this together. And going back to late March, the first press conference we had, in Gallatin County. It was the day we got our first case. We didn't even know we were going to get the case that day. But one of the things I said is we need to treat each other with respect and dignity and kindness and grace. And I think we need to keep doing that. And we're making sacrifices for one another. I think that's becoming more and more difficult the closer we get to election day. It's getting more tense. There's just a lot out there. One thing I would ask everybody is to listen, to make sure that they're giving their neighbors the benefit of the doubt, and to think about doing things that are a sacrifice for those around us, whether that's putting on a face covering or skipping that event that might be a tradition, but would help us limit the transmission of the disease, or just finding a way to ski without packing into a lodge, and maybe finding a way to eat lunch on a nice day out on the slope rather than going into the lodge. Those little decisions that we make, not just for ourselves, but for the people around us, for the businesses that we're trying to support, having some grace and some patience and trying to see things from other people's point of view, I think is going to be really critical. And if there was one thing I could wish for right now, it would be that.
Yeah, absolutely, for sure. Let me just ask one last question on this, on the COVID kind of topic. I mean, it's sort of dominating everything, and it's dominating part of this interview, but I do think this is important. Matt, hospitalizations are up. There were 15 reported today, up from 10 on Friday. What does capacity look like right now? And, with Yellowstone and Gallatin counties, as I understand it, there's an agreement of sorts with patient sort of, overflow. How does that work? And are any of these 5 new patients from Billings and Yellowstone County?
I can't answer that last question definitively. I don't think so. I think we're seeing more cases here in long-term care facilities that are probably creating a lot of those cases. We're also finding some cases in people who are going in for operations and that kind of thing. What we're seeing happening in Billings, and what I'm hearing is happening in Billings, is things like, their intensive care rooms. They're now doubling up on their intensive care rooms because they're running out of space. They're converting offices into what's called med surg rooms. So for people who are on the medical or surgery floor, they're converting offices into rooms. They're doing diversions to long-term care facilities. They're activating their surge plans. These are signs of a system in crisis. These are signs of a system that's being pushed to the brink of its capacity. The CEO of the big hospital system up in Great Falls last week said, we are in the middle of a public health crisis, and this is not sustainable long term. What that means for us in Bozeman, we have the hospital in Bozeman has about 20 critical care beds. For about a week or 2 weeks, they've had about 12 people in those beds. They've been running around 65% capacity. That's pretty good. I mean, that's where we want it to be, where we want it to stay. The concern is when you have all these folks who are out there in long-term care facilities. We have over a half dozen assisted living centers where we have active cases right now. The concern is if we can't get that under control in those centers, that could really change things for the hospital. If we have, it's not just COVID, it's heart attacks, it's strokes, it's car accidents, it's you name it, anything where people would go to the hospital and end up in intensive care, that adds to the burden. Our hospital has a surge plan. Our hospital feels pretty good about where they are this moment. They also are aware that can change pretty quickly. And they're talking every day with other hospitals throughout the state of Montana. And when you have the situation that we have in Billings and in Great Falls, that just takes away some level of flexibility that we have here locally. We don't have as many places to go. We could also look at Helena. We can look at Missoula. We can look at smaller critical care hospitals. But the other thing that's a little scary right now is when you look at those case counts, you go through, in the first surge we had, Gallatin County was leading the pack. And now it's just about every county in Montana. And there's really small counties with 7,000 or 8,000 people that are leading Gallatin County in the number of cases some days. And so those hospitals are going to be pushed too. So it is concerning. It's probably the number one biggest concern I have in terms of being able to keep everything functioning. Because once your hospital tips over, once you get to the point where you're reaching capacity, that doesn't just affect COVID patients, it affects anybody who needs to go to the hospital. So we're watching that pretty closely. And what happens in Billings, what happens in Great Falls definitely has an impact here.
Yeah. Well, thank you for that insight. I think that's important, to understand. I don't want to downplay anything. I don't want to, any importance or seriousness of this. But, as they say, it's not all bad. Sky Resort has a lot of some really interesting initiatives that's bringing up. Troy, you have some ambitious goals and doing some great work in the sustainability field. Can you tell us a little about some of these goals and chairlifts and net zero goals?
Yeah, certainly. It could be all encompassing thinking COVID, but we've been trying to keep our eye on the ball beyond that. It's easy to set some of those initiatives aside, but we've chosen not to. We stated we had a sustainability goal of net zero carbon emissions by 2030. And we certainly didn't postpone that. We started last March, surprisingly enough, with all of our lift operations running on now clean energy. So we, which I think one third of our total electricity consumption is through our lift capacity. And on top of it, we're seeking out more efficient lifts. The technology these days is very different than some of our legacy lifts, and replacing those out in that plan. As you all know, that Swift Current 6 replacement that was planned for this summer, it was postponed due to supply chain concerns and a lot of things going on with the COVID situation. But we jumped back in, and we've completed or nearly completed the foundations and set us up for a successful next summer completion. So that lift will be online fall 21.
Nice. Oh, that's great. Well, sorry, I didn't mean to interrupt you there.
No, that's right. The other exciting stuff in sustainability is those. We have another program we're going to be announcing very soon, which allows our guests to go on a site and calculate their carbon emissions for their travel and purchase rec credits to offset that, which we're going to be excited to announce soon. So we're certainly pursuing a lot of these initiatives that we committed to pre-COVID, and they continue on.
Yeah, I've been reading, a lot of resorts are aiming to reduce that footprint, that carbon footprint. Is there any plan in the works for a net zero goal down the road?
Yeah, that was the real statement that we made, is a 2030 net zero goal. And so all of our planning right now, as we've shared with our 2025 plan, we have a lot of construction, a lot of new lifts, restaurants, a lot of things in play. And in the center of all that planning is how we're going to do that in a sustainable fashion. And it's an expensive process to go through, but something we're committed towards. And that's part of all of our planning moving forward.
Mm-hmm. Troy, as you know, we're working on a story about, J1 visas, and President Trump on June 22nd temporarily barred a variety of foreign work visas, including the J1 visa. Numerous ski resorts depend on J1 workers. I used to work and patrol at Kirkwood in California, and it was a very, they depended very heavily on that in Tahoe and a number of those resorts, to fill those winter jobs, those J1 visas. But Big Sky Resort isn't as heavily affected by this, and you're actually seeing more American applicants for this upcoming season. I was wondering if you could tell us why, talk a little about that.
Yeah, sure. Our J1 program has always been a essential part of our labor force, and something that we've been proud of. Brings a lot of diversity into our workplace. But I think it's under 5% of our total workforce. This winter, we truly have had record applications from domestic applicants, a lot of high demand, college students that are in a gap year, probably a number of reasons why there are people looking to be in a ski resort this coming winter. So it hasn't created a challenge for us with not having access to J1s specifically this year. And we're in a reasonably good place when it comes to filling out our labor force for this winter.
Gotcha. Well, that's good to hear. It's interesting that, the sort of irony in it, a pandemic affecting this workforce, effectively taking away certain components of that workforce for some resorts, and then at the same time filling it because students are taking a lot of college students are taking that year off and coming out to see what ski resort work is like.
Yeah, I wouldn't have anticipated that turn of events, but that's probably a fair description.
Sure. Lastly, you guys are both, longtime skiers. This is in a La Nina year. What are you most looking forward to this winter? Matt, let's start with you. Nope. Matt, we got you?
He's on mute.
Oh, you're on mute there, Matt.
Sorry about that. I think can you hear me okay?
Yep, gotcha.
I think I'm looking forward to getting my kids back out on the slopes. It's been a long haul since March.
Yeah.
I Friday afternoon, I was able to get out on the rivers and actually catch a trout. And that, I'll tell you, is pretty remarkable therapy. And I find the same thing when I'm on the slopes, especially when I can see the excitement with my kids learning how to ski. So skied ever since I was a little kid, looking forward to just being out there and making sure that we're taking advantage of the assets that we have, because it's hard. It's been a hard year. And I think we all need those breaks. And so we're trying to, we make our staff get the heck out of here. We've been operating 7 days a week since March. We really try to make sure we're getting people outside. So I think that's what I'm looking most forward to this winter.
Oh, it sounds great. How about you, Troy?
Yeah, Matt, referenced it's part of our lifestyle around here. It's our therapy. And I know our season pass sales have been strong this past summer and shows that pent up demand for people, how important skiing is to their lives here. Closing on March 15th last year was quite a somber way to finish the season, and still, shocked so many of us. It was the right thing to do, undoubtedly so. But I look forward to getting back out on the mountain and skiing, fresh air, and it feels like you're out in the backcountry sometimes around here. I'm excited to say that, you mentioned La Nina, which is usually a pretty favorable thing for us in this region. We have had a few successful snowmaking nights already, which we're excited to announce and share. And looks like we have some favorable weather coming our way in the next few days. So that's all good news for this winter. Everyone's trying to keep a positive attitude and keep that lighthearted goal in mind that it's skiing, and hopefully everyone takes that attitude into this winter, that this is just a bonus and it's one of those things that keeps us sane.
Yeah, no doubt. I for one, I'm looking forward to some turns with you guys. Gentlemen, thank you really for your time this evening. Really appreciate it. Missy, Botha, thank you if you're watching still. Really appreciate your time and congratulations on a great season. We're all hoping and praying for a safe winter, one that emphasizes that mutual respect that we all have for one another. One where we can keep the lift spinning in the midst of this concerning time, and one where La Nina brings deep snow and epic turns. We are all looking for the best. I think, as Matt said, I just would love to repeat his sentiment that he's talked about since we've been reporting on this coronavirus since last March. Having respect, dignity, kindness, and grace for one another is critical at these times. Let's work together and we'll get out of this on the other side. Thanks again to our sponsors, Big Sky Chamber of Commerce, L&K Real Estate, Shore to Summit Health Management. And thank you all for tuning in. I'm Joe O'Connor with EBS on behalf of Brandon Walker and the entire crew here at Outlaw Partners. Thank you for joining us and have a great night.